Hi, I'm Ray Campbell, Executive Director of the Massachusetts Health Data Consortium, and one of the topics that has been showing up with increasing frequency in the gatherings that we do of health IT professionals and healthcare professionals are issues related to identity management in healthcare. As health information technology adoption is growing rapidly and as more applications and uses for HIT are happening, we're increasingly running up against identity management concerns, both on the provider side and on the patient side. For instance, if you think about in the ideal paradigm, patients would have a great degree of control over who accesses their information and for what purpose. A patient might wish their entire medical record to be accessible by an emergency room physician in the case of an emergency, but during the course of more routine care, they may want to segregate certain information, say behavioral health or a sexually transmitted disease. That might not be something that they want their primary care physician or somebody that's operating on their wrist to know about. So having a patient's ability to control their information in that granular way, you really need to have very strong identity management capabilities with the patient, but also with the providers, so that you can understand who it is that's trying to access the information, why they're trying to access it, and to be able to track that. So far, identity management in healthcare is really very basic. It's something that's done again and again. Every time you encounter the system, you tend to fill out the same information or give the same member identifier number, and those numbers don't travel well between organizations. So to come up with a interoperable and secure identity management infrastructure for healthcare is both very important and, frankly, something that we're not that far down the road on understanding. So there's a lot of work that needs to be done in that area for us to really realize the promise of health IT.